Organization of CNN. Michael, please go ahead.
Thank you. Thank you for taking my question. It's Michael Bociurkiw here. I'm a regular contributor to CNN Opinion. My question is, I guess in a way, kind of theoretical one. I know WHO has been over the recent years prioritizing mental health, and I'm wondering if we're getting to the point in the pandemic, especially in developed countries, where there's now a concern between, of course, the pandemic and the sickness that is happening, but also the impact on mental health, especially when people are on kind of the end of the rope in terms of hope. Many are losing their businesses, many have been furloughed. And my question is the following: do you think that government should now be perhaps in their calculations on reopening, taking more into account the economy and the impact on mental health? And I'll give you a quick example. Egypt seems to be a country where they put more of a priority on the economy and not downgrading public health, but putting a lot of emphasis on the economy, because a lot of the economy there is made up of small businesses. So should governments kind of be recalibrating in order to prevent a mental health crisis up the road? Thank you.
Thank you very much, Michael, and apologies again, and I'll hand over to Dr. van Kerkhove.
Thanks very much for the question. It's an excellent question, and the answer is absolutely yes. There's a lot of work that the organization is doing looking at mental health, and we have been for years, but in particular with this pandemic, really recognizing the incredible toll that this has taken on every single individual, no matter where you live and no matter what age you have. There are variations in terms of the impact that this has had on individuals, whether you have lost a loved one or a family member or a friend to this virus, whether you've lost your job, children who haven't been in school, people who are forced to stay home in very difficult situations. The organization, through our department on mental health, has been working to find ways in which we can support people through this. But it goes beyond the acute phase of where we are right now, but also thinking long term. So absolutely, there needs to be a lot more emphasis by governments, by communities, by families, by individuals to look after our well-being. Some of that we can do ourselves, but some of it we need support. And just to also say, for anyone out there who is feeling the pressure of this, and of course all of us are feeling that too, if you need help, please reach out. And those of you who have friends and loved ones who you know are struggling, also reach out to them. Every day, you should make a phone call, make a connection with individuals to reach out and make sure people are okay. Ask the question once, are you okay? Ask the question again, are you okay? And find ways to connect. We say physically distant, not social distancing, because we want to make sure that people remain socially connected while they are physically distant. And we also recognize the duration of this pandemic in our 14 months now, without having the hope of vaccines and vaccinations, and that should definitely be a sign of hope. Other signs of hope are that we can control this virus, we can bring transmission to its knees with individual level measures supported by communities, leaders at different levels. We have some power in that. And find ways to find joy every day. No matter what you can do, whether it's making that phone call, making that connection, listening to some music, getting some sun on your face if you can. Find ways to smile every single day.
Thank you very much, Dr. Ryan.
Going beyond the absolute impacts of the disease itself on people and on families, and the mental health strain of having a loved one ill and not being able to see them in hospital, and the terror and the tragedy associated with that, the mental stress that frontline workers, health workers have been under, communities and so many others have been under. It's one thing to say that mental health is and psychological health is under pressure. That's true, but it's also the opposite of that has to be what we're doing to support and provide psychosocial support to people and communities. And I think that's what we really need to talk about, not measuring. We need to measure the mental health impact and understand truly what's happening, but I think there's a point where it just becomes unethical to continue to call something out as an issue, but not actually focus on solutions for people and communities. And I'd just like to recognise the work that Deborah and Mark and the people here do in the mental health programme. They've been outstanding. This has been a Cinderella area in health, in public health, for too long, and certainly in the work that we do in humanitarian settings, mental health and psychosocial support is a huge part of humanitarian intervention. And it's a very practical issue. If individuals and communities are not physically and mentally healthy, it is very difficult to absorb the strain and stress of an epidemic. It is very difficult to sustain behaviours that stop the epidemic. There's one thing this virus seems to love, and that's despondency and incapacitation of our ability or willingness to stop the virus. And I sometimes wonder whether it is that impact that is the most profound. And when it comes to recovery plans, and as we all hopefully begin to look in this year, I hope, at how we're going to recover from this pandemic, the mental health and psychosocial support to individuals and communities must be central to all recovery plans, and it must be costed in to those plans.
Thank you. Just would like to add a bit on mental health. I think all has been said, just one dimension only. As the world remembers, may remember, it's a long time now, after the Second World War, the world has experienced mass trauma because Second World War affected many, many lives. And now even with this COVID pandemics, with bigger magnitude, more lives have been affected. Almost the whole world is affected. Each and every individual on the surface of the world actually has been affected. And that means mass trauma, which is beyond proportion, even bigger than what the world experienced after the Second World War. And when there is mass trauma, it affects communities for many years to come. So the mental health problem, it's not an issue of just current, like during the pandemics, but even for many, many years to come. And countries have to see it as such and prepare for that. And WHO will support in any way possible to address the mental health as a big proportion, which is the mass trauma. Thank you.
Thank you, DG and all. With this, we come to